Hi guys, thanks for joining. This is Essence of Medicine. Today we're talking about hypermobility. And I'm Marfan.
And I'm Dominic Moore.
And I'm Dr. Abbasi.
Well, you always ask, why did I choose a topic? And I want to know a little bit about myself. I do have hypermobility. And it was brought up to me at my yoga class one time. So then I was like, I should talk to my boss doctor about that. So,
Okay, show us.
I am hypermobile. I was showing off
Okay, it caused me pain to watch it.
Yeah.
I have to look away. But
Warning.
So the one that I hate the most is my elbows are very hypermobile. But additionally, my wrist/arms.
Oh. He said you need a permit for that. He said his work was you need a permit for that.
Watch this. Watch. Maybe you
I don't
look
want
at
to
how
watch.
this is when I bend it.
I'd like to say we watch people get cut open, and this is this is the part that creeps me.
What we do when they're under general anesthesia.
Yeah. You shouldn't be awake right now for this.
It doesn't hurt at all. Actually, sometimes
There's us.
Yeah.
There's us.
it feels good. Sometimes I feel like I have to. No, like, for example, my thumbs. I was just showing them. I can bend each of my thumbs all the way back. And my fingers can go very far back too. And it feels really good for me. Sometimes it feels like stretching. And when I go to yoga, which I do very often, I try and go 5 days a week. Sometimes I have to prop like blocks and things like that when I'm stretching my legs and my back because I literally do not feel a stretch. So then I put my legs on some blocks so then they're elevated and then I can stretch a little bit more. And I was talking to I was talking to my yoga instructor about it because she's hypermobile too. And she said that being hypermobile is not a good thing. It actually can cause you a lot of bodily damage. She used to be a swimmer, and when she would swim, she actually like hyperextended her knee. So that's why I wanted to.
So they have a name for that.
Hypermobility.
Well, they have.
Oh, you're not asking me. They have a name for it. There's a medical term. You're saying.
Well, there are multiple medical terms for that, and one of our most important president might have had that.
Oh, really?
Mm-hmm. Which president?
I don't know.
Lincoln.
Wait.
You didn't even give me a chance to guess. Lincoln and I share a birthday.
Disease.
And Misha, our other coworker, is also born in February. We're 6 days apart, and he's hypermobile.
Wow.
I was also born in February, and I'm normal human.
Okay, so maybe it's not a February.
I'm the October person, and I'm normal as well. No, what does that mean? Even hypermobile? See, hyper means more than usual, over. But what is a normal? So we can talk about what's hyper.
Yeah. So a lot of range of mobility, usually locked by the joint. I might be a little bit less flexible, but if you remember Amanda's arms from earlier, mine goes to a flat, like 180 degrees. Hers extends beyond that.
Yeah.
So,
no, generally, our joint are designed to do a function. And like the reason you can extend it all the way straight, because when you are all the way straight, that's the farthest distance you can be. If you need to be any shorter than that, it's enough to be in one direction. There's no reason to, no function. There is no function in being able to bend it the other way. Now, cats, you will see there's a joint. They can jump like 9 times their own height.
And they can actually like put their bones in different places so then they can go into smaller areas.
Well, because the way their lifestyle requires, things that they enable, and they store energy in their tendon. They have like, most of the cat, if you look at their feet, that actually they have 3 joints.
Yes.
Okay, because they store it and jump by storing the energy. So obviously it's animal or human specific. What joint to what degree it should be mobile. Now, there is a reason most of us can go with the arm back because we throw things. And there is a reason that, we are able to stretch our feet, our legs, but there is really no function to go over 180 degree in most of our extremity joints. Okay, like if you, and that sort of, I see that if you are with your muscle and tendon, now obviously passively we can do that, but generally in most of our joints, straight joints, there is a range of motion that is functional, and if you can bend it beyond that range of motion that's functional, it's called hypermobility. And and there is a reason we call it hypermobility, because most of people cannot do that.
Mm-hmm.
Mm-hmm.
Now, people who can do that and it's hypermobile, there are sometimes it's just and obviously not every human is built the same way, and our ligaments and the more than the joint itself is what prevent that. That means that ligament is able to stretch more than in a usual condition, and there are some diseases that can make your ligament more mobile than other people. You went to school. Tell us about them.
Yeah, so one of the most common ones, and there are a bunch of subcategories for this, but you'll probably hear about it, is Ehlers-Danlos syndrome. It's usually where the ligaments that make up the parts in those joints that sort of lock things and keep it, they have a reduced amount of collagen. Now, each of the subtypes is usually different joints, different other conditions you have.
Section of that, yeah. It's a genetic disease, right?
It's genetic. It is genetic. And it's usually just determines the way that collagen, a protein, is deposited in your body, and lower amounts of it mean that you have greater joint laxity.
Or different protein, or different composition of protein. And see, you remember I talked about the cats? Now, to store energy in a ligament, that ligament need to be have some elasticity. Okay? So nature tries everything. And that is what nature is good for. Now, it tries everything. Now, if there were some in a few million years that are human that can jump like cats 9 times their weight, 9 times their height, that might become what we call Ehlers-Danlos syndrome or disease. May become something functional.
Was that ever is something important? Because I'm thinking about maybe a long time ago, people that were living in caves and so on, they were more active than we are now, and probably jumping over things.
Yeah, they were more active than we are. Yeah.
Yeah, and probably they had to jump over caverns sometimes.
Now, there is a theory of people who like to read the book, very good book from Richard Dawkins called Selfish Genes, and every gene competes with all the other genes in combination, and it's almost like genes like a little bit of individuals. They cooperate with other genes and so on. Every genes that exists, that we call it a disease today, there is a reason they didn't die out during our evolution, because in some situation, in some specific situation, does give some advantage to people. Like, you want to talk about other things that we call it absolutely a disease, but that's actually a sickle cell anemia.
Yeah.
It makes you more immune to malaria. More people will die of malaria than sickle cell anemia. So it gives you some advantage. So in the fight of the genes, it exists. Let's talk about diabetes. It's a disease? Well, it's a disease if you can go to supermarket and every day buy things. If you have episode that for 2 weeks you don't get any food, you're so much likely to survive if you have diabetes, because your body knows the best how to store fat for bad days that you go for. So with Ehlers-Danlos, yes, you're absolutely on the right track. In certain situation, probably does give some people, probably they can jump and escape from the leopard, maybe a little better.
Also, I've never broken a bone. Does that have anything to do with being hypermobile?
And that is something. What do you think?
I think it's possible, but it's one of those ones you'd have to study more of, because maybe that's just being a man.
Oh, that is a mechanical.
Yeah, it's not very risky.
Those studies are already done.
Oh, really?
Oh, yes. So those studies done on mechanical engineering, you can establish the hardness like iron by how much carbon you add to it. Okay. If you have more carbon, you're very, very hard, but brittle.
Doesn't bend.
But it does not bend. Like a hard steel, it does not bend. If you try to bend, it breaks. But it's very, very hard. But softer steel, it bends, it doesn't break. It's not as hard. So yes, you're less likely to break a bone because your ligaments, your collagen in your bone and ligament is the same collagen, or more or less same collagen. It's more prone to bending than breaking. Harder bone, but on the other side, one of the things I think you told me a long time ago, if there's a fight, you're going to run, you're not going to fight. So I think you sort of naturally understand you're not going to fight any fist fight.
Yeah, but
you're better than running. You see that day?
Oh, no. Oh, I'm not saying I'm a good runner either. I still can't run. I used to play hockey, and I never broke a bone during hockey.
No, but what I'm getting at, it's an advantage in one situation, it's a disadvantage in another situation, and it's a balance of the things that makes a gene survive or not. But yes, if you have softer bone, no, not softer bone, if you have a more elastic ligaments and elastic, collagen, you're less likely to break a bone because it rather bends than the energy has to get absorbed in one way or another. It can get absorbed in the ligament, or it can go directly on the bone and break it, or even they pull out the connection. Now, there are tons of different kind of syndromes here. And some of them, then if it's too much, then the ligament break and so on and so forth. Like some even it's not specifically to joint and the ligament, it's when your heart valves and so on can give up, like in Marfan syndrome. It's another genetic disease where, what's the difference between Marfan and Ehlers-Danlos?
So the interesting thing with Marfan's is actually a lot of times you get elongated bones from it too. So it just as Ehlers-Danlos determines the type of collagen you're producing, okay, this is going to be more hypermobile.
Yeah.
For Marfan's, it's just going to determine that, all right, we're going to keep adding this.
But if you look it up, probably is a different kind of, our ligament are made of many, many different proteins. I think the kind of changes in the proteins are what makes it one Ehlers-Danlos and versus Marfan. It's a different protein that is not expected protein that makes one versus another. And I think that is as well reason that Marfan, they have more systemic kind of like heart and so on.
Are they usually taller then?
Yes, they're usually incredibly tall.
Like that guy, like that giant, the guy in the movie.
You mean Lincoln?
No, I didn't even put that together. I didn't put those together. No, I meant that guy in The Princess Bride.
No, perhaps not. So one actually additional thing for
giantism.
Yes, different.
Different genetic problem.
Another example for why Marfan's does a lot more with bones too is that one of the key signs for it is the test is overlapping of fingers and how they work when you wrap them around your wrist, because it's not just long bones. Even these
they're skinny and tall. Their Marfans are skinny and tall, not just big like the guy
Abe Lincoln. Yeah, Abe Lincoln's known for being skinny, tall, got face.
There are some good documentaries out there on NBA athletes who suffered from Marfan syndrome, and it's worth watching those if you have the time.
Yeah. Now, in certain situation, obviously, people turn it into an advantage. Even in this day, most of them are related to circus. Because have you seen those people in the circus? How part of it is obviously, you train from an early age to keep those joints mobile. Okay. But part of that is as well genetic in a sense that, some people just cannot do that. And if you watch those people in circus, how they go in a box or a glass, or then turn around
I've always wanted to do that.
Please don't.
Box girls.
No, we may not let you out of box.
I wouldn't do it here. I would do it with my friends.
You have to do somewhere else. You have to do somewhere. Trust those people, because they put a lid on the things and
walls, one for food, one for water.
Now, but I always was wondering about those people in the circuses and those that. What does it take to bend your spine backward 180? Like some of them, they do that, and that is something that that's a wonderful a diversity of the nature that they stand and then they literally bend their spine. That is beyond just a ligament, because some of those joints, it's exactly, you have joints in the back are supposed to prevent that. So I think from a very young age, they literally do it until that joints are not really joint like a normal person, because especially in our spine, the joints are there to allow you to do certain degree of motion and not more than that, because otherwise your spinal cord may get affected by that.
It's like the back of a chair, the back of the chair, you have some laxity where you get to go back for a while.
But it stopped at certain point.
Yeah, exactly. But if you worked on it since you were, I guess, 6 months old, you could probably get a chair to just bend. I mean, it would probably break, but...
Well, I think sometimes these children kind of get a kick of being flexible, so they keep doing it, and everyone around them is like, oh, that's so cool how you can do that. So they keep doing it for
like
fun.
You're doing
it's from personal experience.
Thumb on the thing and so on. And
is that really how far back
that
you
is,
push your thumb?
that's
I mean, this is... What do you think we are?
What is that?
I can't grab anything. My thumb goes back here.
What is the function of that going back?
What are you going to grab with a thumb like that?
Show your friends.
Okay. Let me tell you something about our hands and legs, because I think that is something I taught when I was in university. I was teaching lots of students. I would tell them, and I have this is one of those stories that when you understand it, every medical knowledge makes sense. And this has come back to that why it is not normal for our thumb to go anywhere beyond 90 degrees. There's no reason for that. Now, have you seen a newborn baby?
Yeah.
If you put anything in their hand, what do?
Drop it.
Drop it? No.
Oh, I'm not around them a lot.
Okay, obviously not. So if you put anything in the hand of a newborn, immediately they grab it. And there is another test, we call that Babinski. What is Babinski? It's as well a newborn is positive, and when you have a stroke and your brain is not, and it's positive again. But first of all, what is Babinski?
It's that flexible curling. Well, I can't show you right now down here, but
no, say it is my foot.
Yes,
okay?
yes.
What do you do to provoke Babinski? Here or lateral side of the thigh? I'm sorry, lateral side of the foot or in the front. And then what do they do? It's very interesting that these four go here. The big goes back.
Yep.
That is the natural Babinski. Now, you ask the question, when do children lose Babinski? When they're born, they have it. It's positive. It's normal. When they start walking, then they lose Babinski. When they have a stroke, then their spinal cord is messed up, or brain is messed up. Spinal cord take ownership of that, then it's become positive again. As a matter of fact, it's a sign that you have a first motor neuron problem. Okay? Why do we have Babinski? I mean, there's nothing coincidental in human body. Why do we have Babinski? Now imagine I'm a monkey. I'm swinging from one branch to another. This is one branch, I'm swinging to other. I have to be able, if I get to the other branch, I have to be able to grab it, not just with my other hand, but with my both feet and my hand. All four need to be functional. Now, imagine I swing and I hit the other branch. This goes forward, this goes backward to grab around the branch. Otherwise, I'm on the floor of the jungle and I'm food for something else. And imagine that your feet, like with monkeys, as well can grab. Same thing. You hit something on the side or thing, the toes go forward, the big toe goes backward, so it can grab around the tree. And it goes farther. Imagine that when I hit it, I don't aim right, and instead of hitting it this way, I come like this. I hit my shin against the branch. And I'm sliding. This goes here, this goes back, so when I grab it, I can go around it. Now, that is a variation of Babinski, that you scratch the front of the shin, and there's a different name, but same mechanism. So you see, nature is beautiful. Nature is functional. Okay, so talking about that, why we cannot do that? It has no. I cannot grab no more tree branches better by having this further back here.
Mm-hmm.
Okay, so and the same thing here, straight, and then all the way full, so I can grab things. Except you are planning to grab things with the back of the head. You never know. That maybe that's you can be in some of these shows.
Yeah, I'm busy working.
Yeah,
I would go to a show.
Yeah.
And then another kind of important thing to mention about HSO, there's no function to that. I'm sorry. It's cool. Maybe to some people.
There is a function to me.
It freaks me out.
Yeah,
but
the function is freaking out.
That's the function. But it's not necessarily a hindrance. And that's why it gets to persist, that gene. That's one of the things with evolution. If it doesn't kill you enough, then it gets to persist.
Yeah, if the nature doesn't care, like there are many genetic disease that you get it in your 40s and 50s. Nature doesn't care at that point.
Yeah, you had
your babies, and they're brutal. Some of them are brutal, like the Huntington disease. And so because at that point nature is saying, you live, you die, I don't care. Now, not exactly, because if your grandparent live longer, they give a more survivability to the grandchildren. So nature does care to some degree. So it's a very complicated balance and harm of different factors there. But you're absolutely right. If it doesn't change your reproducibility and your survivability in the childbearing age, most of the time the nature let it go. So it's not, as long as you don't get to a boxing competition, you'll be fine.
If I got in a boxing competition, my flexibility would be the least of my concerns. I can't even.
Face would be your first concern.
Oh, my first concern would be like, what's the proper way to throw a punch?
No, how can I save my nails? That's what you're saying.
No, my first thought would be like, which direction should I run?
But something you told me, and I have noted that as well, you bruise easily.
Oh, I bruise very easily.
So?
And I've always wondered
why.
Is that anemic?
I'm not anemic. I got tested.
Okay.
No. She bruises easily because the same protein that is not as strong as in you and I, which is in the bone and the ligament, is as well surrounds smaller vessels. So if you get hit there, those vessels are oozing faster, and that's what a bruise is. Bruise is blood under your skin when you get hit. Now, it takes a lot to cause me a bruise. As a matter of fact, first time that I noticed that my daughter, the older one, getting really strong is first time, because she used to hit me, and I said, hey, I'm not feeling it. And then one time she was hitting me, and she would give everything, and it was hurting. I still said, no, I still don't feel it. And she was offended, but then I had to relax. But I bruise not easily. But people who has like Marfan and so on, or Ehlers-Danlos, they bruise as well easily. And all of that fit because the same protein is the same. If you have a functional, structural protein called collagen, right? And then there are some other proteins that in combination with collagen, they make a network of very tough tissue. That tough tissue sometimes we use as leather.
Oh, yes.
Leather is the same. It's the collagen layer of cows or other animals' skin that we denaturate and make it leather. And leather is the hardest thing, right? One of the hardest thing or toughest thing is leather. Okay? So, and now the same protein is not only in your skin or in your ligament and bone, the same as well surround everything that's structural, which is your vessel. It is in your muscle, separate the muscle fiber. It is in the capsule around your liver, in the membrane that protect your brain, the dura. As a matter of fact, the name dura comes from actually Latin. Okay, there's a good story that I have to tell you. It doesn't go millions of years back. Okay?
Membrane.
So, what is the official name of the membrane, which is the same membrane that we are talking about, hypermobility? It does not mobility, but it's a membrane. It's made of collagen. What's the name of the membrane around our brain and nervous system?
With the dura mater, is that the one?
Dura mater.
Mm.
Why is it called dura mater?
It matters.
Oh,
Okay.
I'd like to piggyback off that. Pretend I said it first.
It comes from Latin matre, dura matre, tough mother.
Oh.
Oh. There is another thing called pia mater. What's that? Pia,
Weak mother?
soft mother.
Ah, close.
Good.
Soft mother, good.
Gave you context clues.
Yeah. So where do they come from? Where in Europe, it was in Middle Age, in the Dark Age, and per decree you couldn't dissect the cadaver. Arabs or Islamic or Persian scholar, they would dissect, they do anatomy, and they would dissect the brain, and they see this tough membrane and soft membrane. And they thought that gives birth wrongfully. They thought that gives birth to brain. They called it the soft and hard mother because it gives birth to the brain. And once we gave that knowledge back to Europe after they stopped killing each other, and they just took it all over. Now, they took all those knowledge mostly from one book. It's called Canon of Medicine, which was being thought as the most important medical book until 18th century in Europe.
Oh.
Canon of Medicine. Do you know who wrote that Canon of Medicine?
No clue.
It's a guy, his name is Abu Ali Sina. We know him as Avicenna. Canon of Medicine, dura mater, pia mater, soft and hard mother, and so on and so forth. You see, everything, all the knowledge, all of a sudden they connect. The dots are connecting now.
And we only had to go like 300 years back.
Yeah, it wasn't that far.
250 years ago, medical knowledge that we knew was from Avicenna.
That's not that many generations, actually.
No, it is not. It is not.
Yeah.
So, and that is why we dedicated our university to him, the ATU Avicenna Technical University. That's why we dedicated our university to him. He was a very interesting person, but we should do another podcast just about him because his life, his legacy, his achievements are really amazing and require an extra podcast just for him.
Like introduce the scientific method?
That is exactly what he did. He didn't just started it researching something. He started the science ways, scientific path, scientific methods as we know it. Because until then, you just say things are, or somebody told you how things are, and you said it is. But he said there is a way to find things. It's called the scientific ways and scientific methods that you can find the truth independent of who says what. That there is a way, observation, empiric, exam, reducing things to its element and watching them directly and then changing one and see, like, you have a food. Let's say you have a food that, and it's important, it's common sense, it's important, but people miss it. Imagine you have a food that's good and you have a food that's bad. What is the difference? You don't know. Well, there are lots of factors, but there is a way, scientific way to find out. Break it to individual elements and then take one away, or give more or less of one element and see how the taste changes.
One variable at a time.
Scientific method. That's what it is. Scientific method by observation, examination, manipulation of variables, and so on and so forth. So ATU, look it up. It's called...
You can literally look up Avicenna Tech and it will show up. Thank you guys for watching. We talked about hypermobility. I'm Amanda Armagast.
Dominic Moore.
And I'm Dr. Abbasi for Essence.
Thanks, guys.
Seriously.